This is the Life by Design with Angela Weiss podcast, episode 67, the Perimenopause Conversation, part 1. Wait, is this perimenopause? Welcome back. I'm Angela Weiss, dual board-certified nurse practitioner, author, and a woman right here in this season with a lot of you. Today I want to start a 3-part conversation about perimenopause because I really think that women just aren't as prepared for it as they should be. Most of us grew up hearing about menopause. We knew there would eventually be a point when our periods stopped and we heard about hot flashes. Maybe our moms or grandmothers talked about the change, but I don't remember anyone sitting down somewhere around 35 or 40 and saying, hey, just so you know, years before your periods actually stop, your hormones may start fluctuating and you might suddenly feel more anxious, irritable, exhausted, distracted, emotional, sweaty, overwhelmed, forgetful, or just not quite like yourself. Nobody really explains that part to us, do they? And that's what I want to talk about today. Before we get into it, because I am a licensed healthcare provider, I do want to give you my usual medical disclaimer. This podcast is for general educational and informational purposes only. Nothing discussed here creates a clinician-patient relationship, and this episode is not individualized medical advice, diagnosis, or treatment. Your personal medical history, medications, symptoms, family history, and risk factors matter. So please talk with your own qualified healthcare professional before starting, stopping, or changing any medication, supplement, hormone treatment, or other treatment. If you're experiencing severe symptoms, thoughts of harming yourself or someone else, chest pain, significant bleeding, or another urgent medical concern, please seek immediate medical care. Okay, coffee first, right? Let's talk about it. First of all, perimenopause and menopause are not exactly the same thing. Menopause is technically diagnosed after you have gone 12 months without a menstrual period, assuming there isn't another medical reason that perimenopause is the transition leading to menopause, and that transition can go on for years. That's the part I think that surprises us most. It isn't necessarily, I had a hot flash, my period stopped, and now I'm menopausal. It can be much messier than that. Your periods may still be regular for a while, then maybe they're shorter, longer, heavier, lighter, or maybe you skip one, or a lot. Then everything looks normal again. Meanwhile, you're thinking, why am I suddenly waking up at 3 a.m? Why am I so anxious, and why can't I remember anything? Why does my brain feel so foggy? Why does everyone irritate me so bad? Why am I sweating when no one else is hot? Why do I feel like my body is doing something completely different? And sometimes the first symptom, it's not a hot flash at all. Sometimes it's sleep disruption. You fall asleep fine and then suddenly you're wide awake at 2 or 3 a.m. That's me. For absolutely no reason, or you wake up sweating, or you're tossing and turning all night and then wondering why you're so exhausted, irritable, and frustrated the next day. Sometimes it's anxiety. A woman who has never really thought of herself as an anxious person suddenly feels nervous, restless, overwhelmed, or on edge. Maybe her heart races, she feels panicky. Things that she used to handle without problems suddenly feel like way too much. And sometimes it's irritability, and I'm not talking about just having a bad day. I mean that feeling where your tolerance seems to disappear. Sounds feel louder, people feel needier, traffic feels worse, your clothes feel wrong. Somebody chewing next to you feels like it's just a personal attack. And you're thinking, why is everyone suddenly getting on my nerves so damn bad? Maybe everybody didn't become more annoying overnight, but your nervous system responded differently. And this is the part of why I wanted to make this a 3-part series, because your hormones and your brain are not operating in 2 separate rooms. Estrogen and progesterone interact with systems involved in mood, sleep, cognition, temperature regulation, and stress response. That doesn't mean every emotional symptom in midlife is caused by hormones. That's important. Sometimes depression is depression, and sometimes anxiety is anxiety. Sometimes somebody has thyroid disease, or they're anemic, or they have sleep apnea, or medication is contributing. And sometimes life is just incredibly stressful. Sometimes it has several things happening all at the same time, but hormones can absolutely be a piece of that picture. And I think one of the most common things women say during this stage is, I just don't feel like myself. Maybe your concentration isn't the same, or you walk into a room and forget why you were there, or you lose a word in the middle of a sentence, or you feel scattered. Your motivation is different. Things bother you that never used to, or your anxiety might be worse before your period, or your sex drive's changed. Maybe your body just feels different and you can't quite figure out what it is. And then we start making those symptoms mean something about who we are. I'm becoming an anxious person. I'm lazy. I'm losing my mind. I can't handle anything anymore. I'm just getting old. And I want women to be careful about doing that. Symptoms are information. They're not your identity. Your body may be simply telling you that something has changed. There are a lot of possible symptoms during perimenopause, and not every woman will have all of them. Some women barely notice this transition, and other women feel like they got hit by a truck. And for those of you, I'm so sorry. But symptoms can include changes in your menstrual cycle, hot flashes, night sweats, sleep problems, mood changes, anxiety, irritability, trouble concentrating, memory complaints, headaches, breast tenderness, changes in libido, vaginal dryness, discomfort with sex, urinary changes, fatigue, palpitations, joint or muscle aches, and changes in body composition or weight distribution. And again, one of those symptoms by itself doesn't automatically mean perimenopause. That's why medical evaluation still matters. But when several things start changing around the same time, especially in the typical age range, it is reasonable to bring up perimenopause with your healthcare provider. And here's another thing women are often surprised by. Your period can still be coming every month, and you can still be in perimenopause. A lot of women think, well, my periods are still regular, so this can't be hormonal, and that's not necessarily true. Hormonal fluctuation can start before major menstrual changes happen. And this is also why a single hormone level doesn't always give you some magical yes or no answer. Hormones fluctuate. One lab value on one particular day may not tell the whole story. Clinicians usually have to look at the bigger picture: your age, your symptoms, your menstrual pattern, your medical history, your medications, and whether something could be causing the same symptoms. That's not it. Sometimes testing makes sense, and sometimes it doesn't. But perimenopause isn't always something you can boil down to one number on a lab report. I also want to talk about sleep for a minute, because sleep can make everything else worse. Imagine hormones start affecting your sleep. Now you're waking up at night. Because you're not sleeping, your concentration gets worse. Your patience gets shorter. You're more emotional. You're craving more caffeine and sugar, and you don't feel like exercising because you're exhausted. Your anxiety gets worse because your nervous system is running on fumes. And now it feels like you have 10 different problems when one of the biggest dominoes may be sleep. That's why I like looking at the whole person instead of one symptom at a time. And then there's anxiety. We are going much deeper into this next week, because the mental health piece of perimenopause deserves its own conversation. Some women develop anxiety for the first time during the season, and other women already had anxiety and notice it's just getting worse. Some start having panic symptoms or feel much more emotional around their cycle. And women with ADHD may notice more trouble with focus, organization, memory, motivation, or emotional regulation. Women with a history of depression, OCD, trauma, PMDD, or other mental health conditions may notice changes too. And again, we don't want to blame everything on hormones. But we also don't want to pretend hormones and mental health have nothing to do with each other. Your brain is part of your body, and we never really had a clean dividing line between physical health and mental health in the first place. There's another part of this that I think we sometimes forget. Look at what is happening excuse me, in many women's lives during the same years. Perimenopause is happening. We may be raising teenagers, launching adult children, becoming grandparents, helping aging parents, changing careers, navigating relationships or divorce, managing finances, grieving people we love, or trying to figure out what the next part of our life is supposed to look like. We may be taking care of everybody else while quietly wondering, who am I now? So then add fluctuating hormones and poor sleep on top of all of that. Of course, someone may feel different. That doesn't mean there's something wrong with them. It means there may be a lot happening biologically, psychologically, and socially all at once. And I don't want this whole conversation about perimenopause to sound depressing either. I actually think there can be some really powerful things about this stage of life. A lot of women start asking different questions. What do I actually want out of my life? What still fits me? What doesn't? What am I tolerating that I won't tolerate anymore? Who am I when I'm not constantly being everything for everyone else? What do I want for the next chapter of my life, the next 20 or 30 years? What do I want that to look like? Yes, our bodies change, but sometimes there's Also more clarity, more confidence, more honesty, more willingness to say no or choose ourselves sometimes when maybe we didn't before. Maybe this isn't just a season of losing something, but it's also a season of becoming. So if you're listening to this and thinking, wait, some of this sounds very familiar, start paying attention to the patterns of your body. Not obsessively. You don't have to track every sensation that you feel. But notice what's happening with your periods, your sleeping, your emotions, your anxiety, and whether your mood changes during certain times of the month. Pay attention to the energy levels you have or your concentration, headaches, hot flashes, sex drive, physical comfort, stress level, and anything else that just seems off. You may start seeing patterns that you hadn't noticed before, and then take that whole picture to a healthcare provider who's willing to listen to the whole story, not just one lab value, not just I'm tired or I'm anxious, the whole picture, because the whole picture is important, and women deserve healthcare that looks at the entire person. Women deserve healthcare providers that look at the entire person and don't dismiss them. And before we close, this is what I really want you to remember today. If you're somewhere in your late 30s, 40s, or early 50s and suddenly feel different, don't immediately decide that there's something wrong with who you are. Don't assume you're losing your mind, and don't assume you suddenly became incapable of handling your life. And don't assume you just have to suffer until menopause gets here. Get curious, ask questions, pay attention to your body, talk to someone who will listen to you, who will really listen. There may be explanations and there may be things that can help. And next week we're going deeper into probably my favorite part of this conversation because it brings my family practice and psychiatric practice backgrounds together. Part 2 is going to be perimenopause and mental health, and we're going to talk about anxiety, panic, depression, irritability, ADHD, OCD, sleep, emotional regulation, and why some women suddenly feel like their brain and emotions are functioning completely differently than they used to. And then the following episode, we'll finish the series with part 3. Okay, what can we actually do about this? We'll talk about treatment options, including lifestyle approaches, hormone therapy, non-hormonal options, medications that can be used for certain symptoms, sexual and vaginal health, sleep, and how to have a better conversation with your healthcare provider about what treatment may be appropriate for you. My goal with this series is not to tell you what you personally should take or what treatment you should choose. It's to help you understand your body better so you can ask better questions and participate more confidently in your own healthcare. And if you listened today and immediately thought of a friend, a sister, a coworker, your mom or daughter, or another woman who keeps saying, I just don't feel like myself, send this episode to her. Sometimes simply realizing there may be a reason I feel this way can be incredibly powerful and validating. And if you're enjoying Life by Design, please make sure you follow the podcast so you don't miss parts 2 and 3. Share the episode, leave a comment, and I want to thank you for being here today. You can follow me on Facebook at Life by Design Press, on Instagram at Angela Weiss Author, and I'll put my author website in the show notes. Okay, go have a wonderful day and take care of yourself.